So the idea now is to talk about a complication of cranial radiation therapy from Radiopedia. So let's start. So we're talking about someone that underwent a radiation therapy, whole brain radiation, for example, or stereotactic radiosurgery, for example, for gliomas, glioblastoma, and things like this, anyway, for tumors. And this radiation may cause complications. So what complications are we talking? So we're talking about the acute phase, which can cause edema. It can be self-limiting, but steroids may help solve it even faster. So you can see that it can cause edema, and therefore it can cause increased intracranial pressure. This increased intracranial pressure can cause the symptoms that you just see: nausea, vomiting, cerebral edema, which can do those things. Now there is delayed phase. We start with the early delayed phase. We're talking about some weeks to 6 months after the area. Radiopedia says 3 months. Anyway, some weeks to some months after the treatment, we are seeing T2 hyperintense areas in the radiation area. The most common place for this thing is the periventricular area. It may be seen as pseudo-progression. Let's continue, and the next time is what is called the late delayed phase, most commonly after stereotactic radiosurgery. Start as early as 6 months after the treatment, but usually between 9 and 15 months, sometimes even years after the thing have happened. Now, late effects usually are irreversible, namely, it stays. Usually, it stems from vascular changes like coagulation necrosis, coagulative necrosis, and things like this. We're talking about radiation necrosis, namely necrosis of some area. We're talking about miniarization, microangiopathy, which may happen more commonly in pediatric population. We're talking about radiation vasculitis, and if we're talking about vasculitis, so you will see stenosis of the vessels, and we can also see capillary telangiectasia and cavernous malformations. You can see here the complications that may happen, and we talked about it. So this is it. This is about complications. Thank you very much.